Assessment Task 2 for BMS 263 Audio-Visual Presentation. Type 2 diabetes is a condition in which the body cannot produce enough of its own insulin or cannot use the insulin it produces effectively. Ozempic assists in treating the patients with type 2 diabetes. Ozempic is the brand name containing the active ingredient semaglutide, which increases glucose-dependent insulin secretion and reduces the release of glucagon when it is not needed. Semaglutide is used to mimic the hormone GLP-1, glucagon-like peptide 1. The semaglutide attaches to the GLP-1 receptors inside the pancreas. This action can either suppress glucagon release by alpha cells or stimulate insulin release via beta cells. Prednisone is a form of corticosteroids which works by altering the gene expression. Ultimately, the main role of corticosteroids is to reduce inflammation and the immune response within the body. This is done by prednisone entering the body as its inactive form. Then once reaching the liver, becomes its active form in prednisolone. Prednisolone is a lipid soluble allowing easy crossing of the cell membrane and enters the cell cytoplasm. Inside the cell, prednisolone attaches to the glucocorticoid receptors, which becomes an activated drug complex when proteins such as heat shock proteins are released. Once inside the nucleus, gene expression is altered by attaching to specific DNA regions called glucocorticoid response elements, altering gene transcription to increase the inflammatory and immune response. Prednisone helps manage asthma by reducing the airways inflammation, allowing easier airflow to the lungs. In case of rheumatoid arthritis, prednisone aids in controlling the immune system's irregular activity that leads to attacks on joints. Although the drugs do not directly interact the same receptor sites, they affect contrasting metabolic pathways involved in glucose regulation. Semaglutide is a GLP-1 receptor agonist when binds to correlating receptors located on pancreatic beta cells. This facilitates glucose-dependent insulin secretion. Additionally, it decreases glucagon secretion from alpha cells, which aids in lowering blood glucose levels. These effects are mediated by intracellular signals. For example, cyclic AMP, a secondary messenger that amplify the GLP-1 receptor within the beta cells. This in turn activates protein kinase A and EPAC, which enhances insulin gene transcription and promotes insulin vesicle exocytosis, ultimately leading to lowered blood sugar levels within the body. Conversely, prednisone attaches to cytosolic glucocorticoid receptors, which are responding target cells. This ultimately forms a hormone receptor complex, which translocates into the nucleus of the cell. Once the receptor becomes activated, it modifies the gene transcription by binding to the glucocorticoid response elements of the DNA, which ultimately upregulates the expression of enzymes such as phosphine that are involved in glucogenesis. Furthermore, prednisone reduces the effectiveness of insulin by disrupting the signaling pathways of insulin receptors, especially in key areas of glucose uptake. This is by increasing the amount of insulin receptors proteins interfering with downstream signaling pathways, which are crucial for movement of GLUT4 glucose transporters to the cell membrane. Although there is no direct interaction between prednisone and Ozempic, their contrasting physiological effects on blood glucose levels are considered a moderate severity. The drug-to-drug interaction between Ozempic and prednisone can be named a pharmacodynamic physiological antagonist. The interaction is an example of a physiological antagonist because of the opposite effects that the drugs have in working the blood glucose levels within the body. Ozempic lowers the blood glucose levels by increasing the insulin secretion by activating or mimicking the GLP-1 receptors. Prednisone then does the opposite by increasing blood glucose levels. This is done by decreasing insulin sensitivity via glucocorticoid receptors and additionally by stimulating gluconeogenesis. It is specifically a physiological antagonist because both drugs have opposite effects of the same function but through different pathways or receptors. The interaction is also classified as a pharmacodynamic interaction as both drugs are affecting the physiological process of being blood glucose regulation within the body. The opposing effects that the drugs have happen within the body, not changing the absorption, distribution, excretion, or metabolism that a pharmacokinetic interaction would. Thus, the interaction is a pharmacodynamic interaction. The interaction of prednisone and Ozempic can disrupt glycemic control. Prednisone promotes hypoglycemia by stimulating hepatic glucogenesis and impairing insulin sensitivity. Ozempic works to reduce blood glucose by enhancing insulin secretion and suppressing glycogen. The antagonist effect between the drugs may lead to Mr. Wagner feeling symptoms such as dizziness, fatigue, polyuria, and polydipsia due to fluctuating glucose levels within the body. The use of prednisone and Ozempic together may potentially aggravate Mr. Wagner's previous history of gastric ulcers. Prednisone, being a glucocorticoid, is known for its ability to hinder gastric mucosal defense by diminishing protoglastin production. Protoglandins typically promote the secretion of protective mucus and bicarbonates of the stomach lining, which helps regulate blood flow to the mucosa, the critical element for healing stomach ulcers. By weakening the protective mechanisms of the stomach, prednisone heightens the vulnerability of gastric epithelium to acid-induced damage, which in turn hinders ulcer recovery. Additionally, high blood sugar levels are linked to increased oxidative stress, weakened immune response, and slowed tissue regeneration, which negatively impacts the repair of the gastrointestinal mucosa. Ozempic slows the process of gastric emptying, which may lengthen the exposure of gastric acids to the ulcerated lining, which can intensify the symptoms of gastric ulcers. The interaction between prednisone and Ozempic has side effects that can affect the treatment approach that physical therapists must be mindful of. Physical therapy often requires patients to move around the clinic, whether this is performing simple exercises or for analysis purposes. The blood glucose alterations within the client caused by the medication may affect the client's ability to tolerate exercise, the client's healing processes, and increased fatigue levels. Additionally, the fluctuating glucose levels can cause significant dizziness for the patients when standing, walking, or participating in exercises which the physical therapist has given. Within the clinic, physiotherapists should recognize the importance of the client's safety. Thus, the side effects caused by prednisone and Ozempic interaction must be monitored to ensure the client's safety. To promote safety within the clinic, the physiotherapist should alter the treatment plan to eliminate the chances of the patient injuring themselves, such as falling over from feeling too dizzy.